Hello doctors. Through this video we want to demonstrate a cheap and easy to make barrier shield around the operating area under the operating microscope with readily available material that not only offers good protection but also a sterile environment to work under. You can easily modify the same to suit your microscope needs. So why the need? As you are aware, coronavirus pandemic does not seem to be relenting anytime soon. We have to learn to live with the virus, making modifications in our ophthalmic practices to protect ourselves and our staff from risk of exposure. With close to 80% cases being asymptomatic, apart from being expensive, the pre-op testing does have a high rate of false negatives. The presence of coronavirus has been detected by RT-PCR even in the conjunctival sac of some patients who did not have any signs of conjunctivitis. Cataract and other eye surgeries have a potential of generating splashes and aerosols, putting both the surgeon and the OT personnel at risk of exposure. While you can protect your nose and mouth with an N95 mask and your body with gown or PPE, let's face it, there are no elegant solutions to protecting your eyes. And the protective goggles available are damn uncomfortable to operate with. All you need to make the hood is a half size, that is a 2.5 by 4 feet sterile transparent surgical green drape, a two-way tape and a few blocks of thermocol. First, apply the two-way tape along the lower edge of the microscope head all around, making sure you don't leave any major gaps. Now the washed up nurse folds the drape in half and cuts off a big triangular corner. Now peel off the top paper from the two-way tape and stick the apex of the cut drape at the center of the microscope head, and then all around, making sure there is no bunching or leaks. Let the open ends overlap, you can even stick them together. Once that was done, we found very little operating room under the drape. Also, there was the issue of the drape bunching and coming in the field of view. We tried using a face shield with a cutout in the center to tent the drape, but the assembly was too unstable. So we stuck blocks of thermocol, or you can use any packing material, to the sides of the head over the drape with a two-way tape, and then applied a two-way tape over the thermocol blocks. This was done by the OT staff, making sure he doesn't touch the lower part of the drape. Also, it is better to do the assembly away from the table. The next step is the trickiest. You need to tent and stretch the drape away from the head in 3 directions and then lift and stick it to the sides of the block. This creates a tent-like contraption under the microscope with enough room to operate comfortably. This is the view from under. As you can see, there is no bunching of the drape in the line of sight. Now that the hood is ready, the OT assistant applies the microscope caps and brings the microscope over the patient after draping, spreading the sheet over the patient's head. These are the view from the microscope with the hood in place. To prevent tackling of the drape every time you pass your hands under the hood, you can stick the nearer edge of the drape to your gown at chest level. The lower edges of the drape are sterile and so are all the insides, and there is enough room to maneuver both hands under the hood. This basically eliminates the necessity of wearing elaborate PP or protective goggles, as any aerosols or splashes generated stay within the hood, providing a safe and comfortable field of surgery. Hope you find this hack useful. Thanks for watching.